Hi, I'm Dr. Mark Joffe, Vice President and Medical Director with Alberta Health Services, and I'm also the Chair of the PPE Task Force. Today, I'd like to provide an update on the joint statement that we have between Alberta Health Services, Covenant Health, and our three health unions, Health Sciences Association of Alberta, HSAA, Alberta Union of Public Employees, AUPE, and the United Nurses of Alberta, UNA, as it relates to personal protective equipment. So just by way of a little bit of background, the original PPE joint statement was signed on March the 26th, 2020. Of course, that was very early in the COVID-19 pandemic. Now, this was a really important document at the time as we began dealing with COVID-19 together. And overall, it has served us very well for the entire year. That joint statement emphasized that protecting the health and safety of all of our workers is critical, but is also a shared responsibility. It emphasized that we would work together every step of the way to keep everyone safe. It emphasized the importance of a point of care risk assessment, considering the potential risks of patients and the activity that would be performed every time with every patient, and then choosing the correct personal protective equipment that would be appropriate to the task and to the patient. That joint statement emphasized that contact and droplet precautions, so a procedure mask and eye protection together with gloves and a gown, are the PPE of choice for interactions with patients suspected, presumed, or confirmed to have COVID-19. And of course, it also emphasized the importance of switching the procedure mask to a fit-tested N95 respirator for anyone in the room when an aerosol generating medical procedure, or AGMP, would be performed. Shortly after the joint statement, a working group came together and reviewed all kinds of procedures that are performed for patients, and AHS created a website to help frontline healthcare workers understand whether procedures that they were performing were considered aerosol generating or not. Together, we've really done an incredible job over this last year of this pandemic, caring for patients and caring for each other. Thank you for all you're doing to provide care for Albertans, for protecting yourselves, and also protecting patients. Every week in the CEO and Chief Medical Officer updates, we have reports of COVID-19 laboratory testing in healthcare workers. I'd call your attention to those, and you might want to start looking at them in those weekly updates. This work and the very detailed reviews that our workplace health and safety teams conduct are absolutely critical to help us understand our risks at work and whether our PPE strategies are working or whether changes are needed. As of March the 10th, 4,800 staff and 200 physicians have had positive test results for COVID-19. Now, very importantly, and I want to emphasize this, very importantly, the vast majority of those positive tests, when reviewed, showed that the individual had acquired COVID-19 in the community, not through their work. Overall, while detailed analysis is still ongoing, approximately 25% of staff and 15% of physicians who have had COVID-19 are thought to have acquired that infection as part of their work. Now, it's detailed reviews of each one of those that help us understand how those infections happen and how they might be prevented. The work is ongoing, but overall, what we've learned from this work is that, for the most part, our PPE strategies have actually worked very well, as long as PPE is used and is used correctly. So let me just emphasize again, our continuous masking and continuous eye protection strategies maintaining 2 meters of physical distance when possible, and paying careful attention to hand hygiene have all been very effective in protecting us against COVID-19. The joint statement that we developed a year ago has served us well, and those strategies have actually worked well to protect our staff and our physicians. Now, recently, the health unions have come forward to ask for a review of that joint statement. Some of the issues that were brought forward as a need for a refresh of that joint statement included some controversy and some confusion related to the possible role of aerosol transmission of SARS-CoV-2, the virus that causes COVID-19, in some settings, and whether this should impact our use of respiratory protection. Now, specifically, in some community settings that are characterized by crowding, by poor ventilation, and lots of activity, such as exercise or singing, there may have been transmission in some of those settings of COVID-19 through aerosols, small respiratory particles. So the role of aerosol transmission, or possible role, along with the emergence of variants that was the topic of the question of the week 2 weeks ago, and recognition that while vaccine will be very effective, the reality is that it's slow to come and it will take time to vaccinate our entire workforce. All of these issues together were brought forward by the unions with a request to refresh the joint statement on PPE. And so we met collaboratively and worked well together over several weeks to come up with a refresh of the PPE joint statement. And that was officially signed off on February 25th, 2021, about 3 weeks ago. You can find that updated joint statement on the AHS website if you search for joint statement, or on the union websites. So some important features of the updated joint statement that I'll call to your attention include statements that we acknowledge that protecting the health and safety of our workforce is a shared responsibility. It emphasizes that health includes both the physical and the mental well-being of our workforce. The joint statement provides an update and some improved clarity on the use of personal protective equipment following a point of care risk assessment or an all hazards assessment. It re-emphasizes that contact and droplet precautions should be used for patient interactions when COVID-19 is suspected or confirmed, and that a fit-tested N95 respirator should be used for all aerosol-generating medical procedures. The new joint statement also highlights that there may be situations where a professional, based on their own judgment, may choose personal protective equipment based on their risk assessment and the specific circumstances where that PPE may differ from the usual direction that's provided. And in that case, that choice of that professional will be respected. Importantly, we acknowledge together that broader use of fit-tested N95 respirators is not going to significantly reduce the rate of occupationally acquired COVID-19. Let me say that again, the use of N95s for all situations is simply not the answer and will not prevent many infections. But perhaps the most important message of all in the updated joint statement is that we are all committed to a collaborative and holistic approach to guide worker safety. And this will include a meticulous attention to fitness to work protocols, utilizing PPE as per guidelines and as outlined in the joint statement, the precise execution of donning and doffing protocols and hand hygiene practices, and maintaining physical distancing wherever possible, and including those times when when you're together with coworkers when not providing direct patient care. Thank you again for all you're doing to serve Albertans. Thank you for all you're doing to keep yourself safe, which in turn keeps your family safe and your patients safe.
Together, we do amazing things every day.